safety then, we need closed-toe shoes, scrubs or a correct uniform. Nails should be short as well, no nail varnish, and you should be wearing an apron and gloves, especially in the decon room, visor and a mask. And then you can see Sam's wearing no earrings and her hair is tied back to comply with health and safety. So in the decon room, we're putting our gloves on, apron, mask, visor, and also the heavy duty gloves. These stop needle stick injuries as well. So what we are doing, please. These are the dirty instruments, so the nurses are bringing them in a sealed container and leaving on the dirty side. So what Sam is doing now, she's filling the first basin with water and she's using the enzymatic cleaner. So normally we have to read the manufacturer's instructions for the enzymatic cleaner and how many we need with the right amount of water. They have to be soaked for a period of time.
Yeah, 3 minutes for this one.
So all the instruments should be separated, nothing too much near each other. So they sit for 3 minutes in the enzymatic cleaner. And then Sam's just going to oil the handpieces. So the correct way to oil a handpiece, you put tissue around the end of the handpiece. You need to shake the oil because it's got the detergent in there and it's got the cleanser as well. So those two mix together. You put the on a stable surface and then oil until you can feel all of the oil coming down the end of the handpiece. You need to check the tissue to make sure there's no blood coming out the end and there's no dark oil as well. So if the tissue is clear, that's fine. You can wipe the tissue down the end of the handpiece. That also cleanses it as well. It can remove any debris ready for the autoclave. Some practices do have the DAC machine, which you put your handpieces in there clean, so I'm not going to touch them at the moment. And then you press the cycle which you want them on. So that just oils them, it sterilises them. Okay, so for the sake of the video, we'll just pretend they've been in for 3 minutes, then we'll have to do it again afterwards. But yeah, Sam's just going to show you now with a long handled brush to make sure there's no splashbacks, and you should be scrubbing everything underneath the water to make sure nothing's splashing back. So again, it removes all the proteins, any cement. If you do see any cement on there as well, you can remove with another instrument. But just be careful, you don't stop yourself, and be careful you don't scratch the instrument. That can harbour bacteria. Okay, so we'll just do that for the purpose of the video. So the second sink needs to be a rinse sink. I would normally fill that sink with water so you can just dip them straight in afterwards. Okay, so then what Sam's going to do, we've got the magnifying glass open. We need to look at the instruments through the magnifying glass to ensure there's no scratches. If there was a scratch and it was quite deep or there's a broken instrument, we'd put that into the sharps bin. If there's any cement or any blood on the instruments, we would just remove that and you start back through stage 1 and then stage 2. With this stage, I'd like the water to be actually filled up so that you come straight out of here and go straight into the water. Okay, so it's ready on the tray now, ready for the autoclave. So for the purpose of the video, we'll just demonstrate just putting it into the autoclave. So you just slide it on there. There we go. Remove the heavy duty gloves again. You've got your clean gloves underneath and then you can just press whichever button. So the autoclave, this is a vacuum autoclave and it goes on for 134 degrees for 3 minutes. Yeah, don't worry about it. Thank you.